So you want to know what Biden and Trump think about healthcare policy? Well, in this video, that's what we're going to cover. Hey friends, welcome to Adulting with Esther, the show where we talk about the things that you don't learn in school. I'm Esther Page, and today we're going to be talking about Biden versus Trump, specifically healthcare policy. This video is part of a 10-part series where you can see all of these topics covered. You can find those videos in the playlist up here or in the description down below. If you're new here, welcome! Consider hitting that red subscribe button down below so you can be alerted when we post new videos on Tuesdays. Oh, and make sure you stick around to the end of the video where I'll walk you through the 5 policies that Biden and Trump agree on. And, just because I thought this was interesting, the 2 on which Biden, Trump, Joe Jorgensen, and Howie Hawkins, the Green Party and the Libertarian Party, if you don't know, come on guys, keep up, all agree on the same thing. Pretty cool. So, without further ado, let's start with the stickiest of all of them. Should abortion be legal? Well, let's get a little bit of background on this one, shall we? In 1973, the Supreme Court ruled 7-2 in Roe versus Wade that abortion should be considered a fundamental right. And since then, it's been a heated topic between states where some states have it as barely legal and some states have a complete total ban. So, what do our candidates think about abortion? Trump is con and Biden is pro. Let's find out why. Trump says he is extremely pro-life with 3 exceptions: rape, incest, and protecting the life of the mother. Donald Trump proudly announces that this is the same stance that was taken by Ronald Reagan and that he must continue to maintain this in order for us to have the win for life in 2020. But what about Joe Biden? Biden's stance? Should he become president, his goals are twofold. 1, to expand access to contraceptives, as well as 2, to maintain citizens of America's right for their constitutional right to having the choice of whether or not they would like to execute an abortion. Moreover, he would like to really bash those laws that certain states have that are somewhat encroaching on their constitutional rights, such as the requirement that a parent must be notified, mandatory waiting periods, and ultrasound requirements. Whew, glad that's over. Is the Affordable Care Act, or Obamacare, actually good for Americans? I'm going to give you a brief synopsis of what the Affordable Care Act is, but I encourage you to do your own research. I have my resources linked down in the description, and I encourage you to check them out and do a little bit more reading on your own. So in March of 2010, Barack Obama passed the Affordable Care Act. The most notable thing about it is that there are tax penalties for those who choose to not get healthcare insurance. What it includes is a mandate that those who do not choose to get healthcare insurance will pay a tax penalty. Proponents and supporters of the Affordable Care Act said that this was revolutionary and a historic movement as it allowed for healthcare costs to be significantly lowered for all citizens. In fact, the Congressional Budget Office estimated that it would reduce the nation's deficit by $210 billion. And of course, the opponents of Obamacare believe that it is socialistic as well as an unconstitutional government takeover of the healthcare system, which could lead to an increase in healthcare costs as well as simultaneously decreasing the quality of the healthcare costs. So, totally opposite of what the people who are for it think. They also claim that over the course of the next decade, we could increase the nation's deficit by $340 billion to $700 billion. So again, totally opposite of what the other group thinks. I'd love to know if there's a right answer to this. So what do our candidates think about this policy? Well, Biden is for it and Trump is not. So let's find out why. Trump says that Obamacare is a disaster, that he is able to execute it and run it very well, but it is still a disaster, and it was under President Obama. Meanwhile, Biden says that because of Obamacare, now over 100 million people have access to insurance and affordable healthcare that they didn't have before, and that gives them a peace of mind to know that they're safe in the event of a healthcare emergency. Moreover, young people who are transitioning from high school and college into the workforce or otherwise are able to stay on their parents' or their guardian's insurance until the age of 26, which can help support them through that transitional part of life. Should the United States leave the World Health Organization, or more commonly referred to as WHO? The WHO is an agency based out of the United Nations, and it consists of 194 member states. These member states are around the world, and they work to coordinate healthcare responses to diseases such as HIV, influenza, cancer, heart disease, and now COVID-19. 51% of WHO is funded by the member states, and the remaining 49% is funded by banks, non-government organizations, and philanthropic foundations. And in 2019, the United States was their largest funder, providing 16% of their annual funding at a total of $419 million. However, in 2020, the WHO has requested an astounding $675 trillion in order to be able to adequately respond to COVID-19. So what do our candidates think about leaving the organization? Well, Trump is all for it and Biden is not. Let's find out why. Trump wants to leave it because he believes that they failed to contain this outbreak and pandemic that we're all experiencing like right now. He also says there's an alarming lack of independence from the People's Republic of China, and thus he doesn't want the American taxpayers' dollars to be going toward an organization that may or may not have American best interest in mind. And on July 6, 2020, he actually wrote a formal letter to withdraw from the organization. However, when a member state withdraws from the organization, they must pay off all debts they've incurred, as well as give a 1-year notice. We're in that 1-year notice now, and we now have to pay $198 million back in dues. Biden plans on rejoining it should he become president. He believes that it is leading the world health and it safeguards American citizens. Okay, so those were the few on which they disagreed. But now let's see the ones on which Biden and Trump have the same stance. Oh, and don't forget, if you're getting value out of this video, hit that like button. First up, should the federal government intervene to end surprise medical billing? I'm sure you can all relate to this event. You go for your biannual cleaning at the dentist and you expect for it to be fully covered by your insurance because you pay your stuff through your employer and you should be good to go. Then a few weeks later, you get a letter from your dentist in the mail asking you for $60 to $100 or even more money. This is a surprise medical bill. And this usually results based upon your insurance being out of network or not being a premium within the network. Turns out about 16% of hospital stays end with a surprise bill. And in certain states like New Mexico, New York, California, and Texas, there's as much as 30% of surprise medical billing happening there. So what do our candidates think? Biden and Trump both want this gone. Biden is hoping to initiate something called the Biden Plan that would allow individuals who visit a hospital yet don't have control of who their provider is to not pay an out-of-network cost and hopefully keep healthcare costs down. Donald Trump goes on to empathize with the American citizen who lays in bed awake at night thinking about the surprise medical bill that they may or may not incur as a result of a procedure they recently had done. And as such, he's working to develop bipartisan legislation that will end surprise medical billing. Should the availability of Naloxone or Narcan be expanded to help prevent opioid overdoses? A little bit of history here. Between 1999 and 2008, there have been over 450,000 deaths from opioid overdoses, resulting from prescription and street use of opioids. Naloxone or Narcan is actually a drug that can reduce the effects of opiates and save the individual if administered in time. And this Narcan is available as an auto-injectable, a regular shot, or even as a nasal spray. However, only trained officials can administer this injectable. But in some states, a family member or a friend may be allowed to administer the nasal spray. Between 1996 and 2014, Naloxone actually saved 21,000 individuals from an opioid death. They're hoping if it were to be legalized that it would prevent more deaths up to a total of 21% of opiate overdoses. So what do Biden and Trump think about this? They're both pro for this issue. Biden is promising, should he become president, to invest $10 million in local communities, getting the funds and the tools necessary to be able to use this tool effectively. He also mentions not just giving this drug and tool to first responders and public health officials, but also to people who work at homeless shelters and even public libraries. And in data from April 2020, it says that Trump, since he's been in office, has been able to make Narcan more available 484% more since he's been in office. And the VA alone has dispersed over 121,000 prescriptions, and of those prescriptions, it helped at least 321 veterans who were suffering from an opioid overdose. Let's keep going. Should the US implement a Medicare for All healthcare system? Medicare for All would be a government-run, single-player healthcare system, meaning the government would offer the only healthcare available, and it'd be paid for by taxpayers. This would eliminate the game of private insurance, and everyone would just enroll in the plan made by the government. So what do Biden and Trump think about this? Biden and Trump are both con on this issue. Biden's biggest reason for not supporting this is because it would mean getting rid of Obamacare. And he is hoping that Obamacare, again, should he be elected, would offer a public health care option similar to the system, but it'd be an option, not for everyone to use, and eliminate the private players in the party. He also mentions that if this were to get passed, we'd have to start over. And we're still fighting about Obamacare, which started 10 years ago. Donald Trump, being the businessman that he is, takes it to the budget. He says that should we do a single-player government-run healthcare system, it would cost approximately $32 trillion over the next 10 years, and he's not for that. He said he's made a promise to the seniors in our country to protect Medicare, and by taking on this Medicare for All, it would not help him fulfill that original promise. So there's two left, and these two, every single presidential candidate agrees on. Joe Jorgensen, Howie Hawkins, Joe Biden, and Donald Trump. Let's see what their thoughts are. Should the federal government intervene to lower the cost of prescription drugs? On average, Americans spend a total of $334 billion annually on prescription drugs, which accounts for about 10% of all healthcare costs. These drugs, their prices fluctuate greatly depending on the market as well as the availability of products, not to mention whether or not you're prescribed a generic brand or a name brand. Some people believe that the federal government likes to intervene on this issue and jack up the prices as needed in order to help them progress their policies that they're working for in office, as well as the reverse, lower the prices as needed. Well, what do all four of our candidates think about this? They all say yes. The government should intervene and make our prescription drugs lower. Right off the bat, Biden says that too many Americans are having corporate companies profit off of them when they're sick. He again references his Biden plan and says that it will actually impose a tax penalty on the healthcare companies of whom try to raise the prices of those prescriptions, or even the companies who abuse the price of generic prescriptions over the rate of general inflation. Donald Trump says that while prices have been going up for 50 years, we have seen it go down a little bit lately, but it is wrong. Americans should not be paying this much for prescription drugs, and he's working to get some other options on the table. That's from November 22nd, 2019, almost a year ago. And the last one. Should Americans be able to import prescription drugs? A poll that was taken in February of 2020 actually found that 78% of Americans are for this issue. And that's spread across 75% of Democrats, 82% of independents, and 75% of Republicans. They say that importing drugs from Canada could lower the cost of prescriptions 28 to 35%. However, currently, the United States Department of Health and Human Services has to approve every drug that's brought in from out of the country. And a study performed in 2004 found that importing drugs would decrease the profit for pharmaceutical companies and thus decrease the amount of funding they have in order to be able to continue to do research to improve those drugs. That one's making me think. What are your thoughts? Would you rather have more affordable drugs, or would you rather have more effective drugs? It seems that we can't have both. What are your thoughts? Let me know down in the comments. But enough about you. What do our candidates think? Biden and Trump and Joe and Howie are all saying yes. We should be able to import drugs to lower the cost of prescriptions. Biden indicates that as part of his Biden plan, once Health and Human Services has approved that the drugs are safe for importation, we absolutely will be able to bring them in so that corporations can stop profiteering off of the sick individuals and Americans that need those medicines. Trump says that he is working right now to find options that are much cheaper because hardworking Americans don't deserve to pay those big prices. In fact, he says, we are fighting daily to make sure that this happens. Well, that wasn't so bad. It seems like aside from the abortion issue, for the most part, our candidates are pretty similar. If you made it all the way to the end of this video, I want to celebrate how wonderful you are. Type this word down in the comments so you can brag to everyone else who comes by. I loved spending this time with you, and I hope you did too. If you got value out of this video, don't forget to hit that like button down below. And remember, press that red subscribe button if you haven't yet. We'd love to see you come back for more. Whoever you choose to vote for, stay you, and I'll see you in the next video. Bye-bye.